So we will talk about the global AIDS crisis from UN AIDS, 2006 report of the global AIDS epidemic. Dr. Peter Payot in Rio de Janeiro on July 27, 2005 said that, I quote from him, "Please let us have no illusion that one fine day the world will return to what it was before AIDS. No, AIDS has simply rewritten the rules. And to prevail, we too must rewrite these rules. With 65 billion people infected to date, nearly 25 million already dead, and the vast majority of the more than 35 million people living with HIV unaware of their status, AIDS is among the greatest development and security issues facing the world today. A challenge of this magnitude requires exceptional ongoing leadership on both the national and international levels. 25 years in the epidemic, the global response to AIDS must be transformed from an episodic crisis management approach to a thoughtful, long-term response that emphasizes the use of evidence-based strategies and recognizes the need for long-term commitment. Despite forward motion, however, the consistent leadership necessary to slow, stop, and reverse this epidemic is not yet evident. পরে আসো সমস্যা নেই পরে আসো Despite forward motion, however, the consistent leadership necessary to slow, stop, and reverse the epidemic is not yet evident. While the Secretary General's report on the Declaration of Commitment on HIV or AIDS notes many improvements in the global AIDS response since 2001. AIDS response since 2001, it also clearly indicates that action overall has been insufficient, with progress uneven within and between countries and regions, and many countries failing to fulfill their pledges. As the report succinctly states, several important global targets for 2005 in the Declaration of Commitment are missed. Now we will talk about sustain and increase commitment and leadership. The Declaration of Commitment on HIV or AIDS calls on the leaders of all 189 nations that signed it to develop and implement sound national multisectoral HIV and AIDS strategies and integrate their response into the mainstream development planning, ensuring the full and active participation of civil society and the private sector. Yet, the Secretary General's report indicates that while nearly 90% of countries report having developed a multisectoral strategies framework on AIDS, many have yet to convert these plans into action. Now let's talk about sustain and increase financing. Global financing for HIV and AIDS has greatly increased, yet funding currently available is barely 1/3 of what will be required to respond to the growing epidemic in just a few years. Now let's talk about aggressively address stigma and discrimination. Ending this pandemic depends in large part on impending a range of efforts to change the social norms, attitudes, and behaviors that drive it. Action against stigma and discrimination must be fully endorsed and supported by top national leadership and supported at every level of society and must address women's empowerment. Homophobia, attitudes towards sex workers and injecting drug users, and social norms that affect sexual behavior. The low status on powerlessness of women and girls has increased their vulnerability to HIV infection and has been a driving force of the epidemic since its earliest days. Societal norms and values that make it acceptable to discriminate against and exploit females must be challenged and changed. Now let's talk about strengthen AIDS prevention. A renewed emphasis on HIV prevention is critically needed. Over 4 million new HIV infections each year will put an untenable burden on HIV treatment efforts that are struggling to reach all those in need today. The success of the movement towards universal access will largely depend on whether leaders maintain a strong focus on the goal of creating an HIV-free generation, mounting a massive social mobilization to dramatically decrease the number of new HIV infections. The internationally agreed upon UNAIDS policy paper, Intensifying HIV Prevention, provides a framework for strengthening evidence-based HIV prevention. Key to this is ensuring that prevention, education, counseling, and voluntary testing are universally available and routinely offered in all appropriate clinical and community settings. UNAIDS and WHO recommend that for HIV prevention and treatment services to have maximum benefit, at least 50% of all people engaging in sexual risk behavior should access voluntary counseling and testing each year. Now let's talk about how to strengthen human resources and systems. The world is now paying the price in the form of the AIDS crisis for decades of inadequate investment in public and private services to promote health and education. Lack of human capacity is the single biggest obstacle to an effective response to AIDS in many developing countries. Poor surveillance, planning and administration, bottlenecks in the distribution of funds, failures in the implementation, monitoring and evaluation of activities, and inadequate provision of services are all largely due to systems of too few people with too few skills. Lack of human resource capacity has reached crisis levels in much of Africa, but is also severe in a number of other countries and regions throughout the world. According to the WHO World Health Report 2006, there is currently an estimated shortage of almost 4.3 million doctors, midwives, nurses, and support workers worldwide. Now let's talk about how to ensure available and affordable commodities. All players must increase action to ensure affordability of the basic commodities from condoms to antiretroviral drugs needed for HIV prevention, diagnosis, and treatment. Ensuring the availability and affordability of vitally needed medicines, including second, third, and fourth generations of drugs, as well as first-line medications, means addressing the complex, sensitive, and contentious issues of pharmaceutical patents. A balance must be struck between ensuring sufficient incentive for drug companies to invest in research and development and enabling effective AIDS medications to be produced as cheaply and widely as possible to meet the needs of developing countries. Now let's talk about how to invest in research and development. Continued technological innovation is vital for the development of microbicide and other female control prevention methods, new generations of drugs and preventive vaccine. Substantially greater research funding must be mobilized, especially from the pharmaceutical and biomedical industries. The needs of children with HIV have largely been left out of research agenda. Pharmaceutical companies, international donors, multilateral organizations, and other partners should develop public-private partnerships to promote quicker development of new pediatric drug formulations. Few international crises have been as extensively studied as AIDS. Thousands of highly qualified individuals have expended countless hours developing the evidence-based analysis and recommendations contained here, and in several other highly relevant documents and reports. When 189 nations signed the Declaration of Commitment that emerged from the 2001 United Nations General Assembly on AIDS or HIV, they recognized in a rare, unanimous, international consensus that AIDS is among the greatest development crises in human history, and its commitment to act nationally and internationally to stop the epidemic. To quote the report of the Secretary General on the Declaration of Commitment on HIV or AIDS 5 years later, a quarter century into the epidemic, the global AIDS response stands at a crossroads. For the first time ever, the world possesses the means to begin to reverse the epidemic, but success will require unprecedented willingness on the part of all actors in the global response to fulfill their potential, to embrace new ways of working with each other, and to sustain the response over the long term. The goals have been agreed upon, and the roadmap on how to achieve those goals has been painstakingly developed. Some positive action has been taken, but not early enough. What remains to be done in too many cases is for the heads of our societies to recognize that being a leader in the world today, whether in the world of government, business, religion, or other elements of civil society, requires being a leader on AIDS. The struggle to implement the plans outlined in this report will be a daily and difficult one. Defeating AIDS must be a shared, global, and non-partisan agenda. To move forward, we must demand that commitment from our leaders, our institutions, and ourselves. So that's all about the topics on AIDS prevention. Here we talked about the sustained and really increased commitment and leadership, how to sustain and increase financing, how to aggressively address stigma and discrimination in cases of AIDS or HIV. We also talked about how to strengthen AIDS prevention. We talked about strengthen human resources and systems. We also talked about how to ensure available and affordable commodities. We also talked to how to invest in research and development. And lastly, we should say that to move forward, we must demand that commitment from our societies, our institutions, and ourselves is a must to improve or ameliorate the situation of AIDS, an endemic, an epidemic that plagues the whole world, the people of the whole world. I hope the WHO or the World Health Organizations will develop some new techniques uh, to uh, to make the disease curable, and we do hope today or tomorrow new research, new medicine will one day be available among us like paracetamol or aspirin to relieve ourselves of AIDS or HIV. So, wishing you all good health and good hygiene, and I would like to thank all the people who have been watching the video with your patience. Wishing you all a good health and good hygiene. Thank you very much.